I'm going to try to be very ambitious today and try to do this talk in 15 minutes so that you guys have plenty of time to ask questions. If there's anything that's difficult to manage, it's people's sleep concerns. There's so many different triggers why someone has sleep complaints. Everything from age-related concerns, to pharmaceutical interventions, to why does my spouse kick me in the middle of the night? There's a ton of different things that lead to fragmented sleep. So I want to be sure that you guys have an opportunity to ask your questions. Okay, now we'll try to be official about this. For those of you that don't know me, my name is Dr. Deedra Mason. I'm our Director of Clinical Education and Research. I have developed a curriculum for health professionals to look at using nutraceuticals, weight management services, things that we offer through Market America within their facilities, trying to help improve patient outcomes. I have a list of things that I think are important for physicians to speak to their health or their patients. And the number one thing I want my health professionals, when I'm working with them, to talk to their patients about is the importance of sleep, quality of life. Too often practitioners spend their time helping eradicate disease or get rid of the symptoms of disease, but don't do a great deal or don't do a great job in helping patients with quality of life matters. Sexual function, stress management, knowing how to manage not just their weight, but an aging body. And sleep falls into some of these basics. So that's what I wanted to talk about today. Many of you would probably be surprised to know how many people would describe themselves with a sleep disorder or with sleep problems. Better than 50% of the adult population, and you're an adult if you're above the age of 20, whether you act like one or not. 50% of adults and better will tell you that they have sleep problems or sleep issues. Most of them are not reporting them to their healthcare provider, are not reporting them to, in this case, a senior partner or someone that's in a management position over them. Anyone want to guess why? People think it's normal. It's normal to not sleep. It's normal to wake up tired. That's normal. Well, I'll tell you what, a heart attack is normal for someone in their 60s. Doesn't mean I want that to be something that happens to you, right? So these are things that we can address. Lifestyle plays a big role in addressing it. But first we have to kind of understand what really is normal. Transient insomnia or trouble sleeping for about a week, that's very common. It's usually something to do, it's episodic, it has something to do with what's going on in your environment, your mental environment, your spiritual environment, your physical environment, very often your work environment. Short-term insomnia are concerned with sleep issues greater than a week but less than 3 weeks. Sometimes do require a little bit more intervention than just meditation, more intervention than just what I like to refer to as sleep hygiene, paying attention to computers in front of you, the way you speak to yourself and the like. And then there's clinical insomnia. These are things that have lasted for greater than 3 weeks, and this is frequently where pharmaceuticals or much stronger or aggressive therapies get involved. When we think about this, though, I want people to understand that many of the things that we perceive as sleep issues, whether it's that week or going up to the 3 weeks, usually are not organic issues. Most people don't have brain chemistry that got so flipped over in a matter of weeks because things like that happen over a matter of decades. Most of us don't have organic issues with sleep. Most of us have the things I referred to earlier, too much stress in our lives, choosing the wrong foods or eating the wrong amounts of food at the wrong time of the day. We have a spouse that literally does kick us in the middle of the night, or we have done some type of behavior that has led to fragmented sleep. It's everything from checking your cell phone in the middle of the night to letting your lights stay on way too long, or skipping what I would like to refer to as copying nature, or skipping the way your body naturally sleeps. Every one of us is run by a cycle, whether it's the moon, the ocean, hormones, light outside. Every one of us is run by a cycle, and we wake up when the sun comes up, and we should try to go to sleep when the sun goes down, when things naturally get dark. What's the issue with that? We watch TV at night, sometimes from bed. That's not what your bedroom is for. Some of us are playing on our phone to have that blue light that stimulates the pituitary gland and prevents you from going to sleep. It tricks the brain into thinking that you should still be awake. Many of us stay up way past our initial signal to go to sleep, And then what ends up happening is we get a second wind. We get that second wind, and when one hormone goes up, another hormone has to go down. That second wind hormone could be cortisol. Cortisol can be run by stress, it can be run by sleep, it can be run by exercise. So we have to pay attention to the things that we're doing during our sleeping type hours, or we have to pay special attention to the way we spend our daytime hours. Different things that can trigger an individual into poor sleep habits are also endocrine fluctuations. Like I said, when one hormone goes up, another hormone has to go down. You'd be surprised at how much stress is still the #1 reason why people will complain of chronic sleep or fragmented sleep concerns. Because when cortisol goes up, issues like melatonin and serotonin start to go down. Melatonin is one of these factors, hormones, that is responsible for your ability to sleep. Serotonin, again, something that gets depleted quite quickly from people when they are overly stressed or do not have good GI health. Serotonin goes down. This is a neurotransmitter that says, it's good, I'm calm, I can handle this. And all of a sudden, it's this vicious cycle where people are getting overweight, people are not sleeping throughout the night, people are becoming argumentative with their coworkers or with their spouse. Another thing that's important to understand when we think about the statistics of sleep is that it's also age-related and gender-related. Women will complain of sleep issues much more than men will complain of sleep issues. Again, it's that cyclic part of a woman. She has cycles, hormones that go up and down. Well, this gets precipitously worse as a woman, or a man for that matter, ages. At about the age of 35, progesterone, which is the feel-good hormone, it's the whittle-your-waist hormone, starts to decline. And for that reason, people start to don't just have issues with weight, they start to have, or not just sleep, but they start to have issues with weight as well. So they think to themselves, what am I going to do to relax? Because today was an awful day at the office, or I just can't handle the kids, or I need a break, right? That whole Calgon take me away thing. Well, we end up finding that stress is still the #1 factor. People are concerned about their financial future. People are concerned and then take a step towards recreational drugs, pharmaceuticals, or just plain alcohol. We start to see more mental health issues as relate of poor sleep or sleep deprivation. So we talk about this. People frequently, when we're managing sleep, will say, that's not me. I don't drink too much alcohol. I don't really perceive that my life is that stressful. Yeah, you know, they'll do that sort of thing, but then they give themselves an out. They bargain with themselves and say, it's normal. It's normal to feel stressed on Monday morning. But do that day in, day out, and you start to see mood disturbances. You start to see sleeplessness during the day, or feeling like you just have to take a nap, which I don't want to take away anybody's birthday here, but one of the worst things that you can do is let yourself take a nap and start that cycle all over again. Little cat naps are fine, 10, 15-minute sleeps, but if you're going to try to take a real nap, it better be more than an hour, and it can't be less, and it should not be more. It should be an hour, and then you should cut it off. If it goes greater than that, you start your sleep cycle in a funky way, and then all of a sudden, at 9 o'clock at night, at 9 o'clock at night, you don't end up getting the signal that it's time to go to sleep. We see more and more people with sick days, calling in sick to work, whether it's because they're sick of work, or they just can't imagine getting out of bed. We also see a medical expense to this. People that do not get a good restorative or restful night of sleep end up having higher rates of high blood pressure and elevated cholesterol. We see higher rates of type 2 diabetes due to the way the body burns energy. When people are deprived of sleep, we see more concerns with acid reflux, or what's also referred to as GERD. This also has something to do with overeating and then folding yourself into the shape of an L and watching something like Empire on TV. That's also one of the issues there. People with pain syndromes most definitely will report that they do not sleep as well, but that's another vicious cycle. People that don't sleep well also end up having a higher than normal sensitivity to sleep issues. We believe this has a lot to do with stress and a lot to do with serotonin receptors in the gut. So whether someone has an irritable bowel type issue, changeable bowels, or sensitive bowels, or they're just not sleeping well at night, we know that serotonin plays a major, major role in that, and pain syndromes. This is, I mentioned here, neurologic diseases, elevation of dopamine. You can have a normal amount of dopamine, but if it's relatively high compared to the I'm good neurotransmitter serotonin, you'll end up overeating, you'll end up overstressed, you'll end up over drinking alcohol, recreational drugs, smoking, any number of things. Dopamine is the I'm addicted neurotransmitter. It's the I can't get enough of that. It's the reward center. For some people, this also turns into how they feel rewarded is getting more sleep. We see more cardiovascular disease, lung disorders, post-traumatic stress disorder, hypersensitivity, or mental issues that lead to substance abuse. Now, I mentioned the medical concerns or the medical expense of not sleeping well. One that hits home for most people is obesity. The one that hits home for most people is this idea that after an age of, you fill in the blank what it was for you, they didn't feel the same. They started to gain more inches around their middle. They had less energy. Losing weight or keeping weight off or strength, all of these things seem to be in a decline for them. We know that people that do not sleep restoratively do put on extra pounds. They literally change what's called the biome, the microbiome in their bellies, where the good gut bugs that are present that deal with things like inflammation, healthy digestion start to go away, and we see more and more inflammation and an endocrine dysfunction. Like I said, when one hormone goes up, another hormone has to go down. And obesity is usually one of the first ways that we'll see this in a physician's office. Fatigue is definitely the first thing that people will complain of. But again, because they think it's normal, they don't do anything about it. It's not until you don't look awesome naked that people start going, we gotta change this, right? And sleep is one of the major factors. Another thing that's worth paying attention to, and this is what always surprises people when I speak, I would rather you slept well than ate well. I can manage what your diet is doing to you later. If you don't sleep well, it doesn't matter if you exercise right, it doesn't matter if you eat right, it doesn't matter if you manage your relationships very, very well. Sleep may be the single most cost-effective thing any one of us do to promote our overall well-being. If you don't sleep well, men will not have testosterone later in their later years for healthy sexual function. If you do not sleep well, progesterone will not do what it needs to do to help women whittle their waist and have healthy cognitive function. If you do not sleep well, headaches are in your future. Weight gain is in your future. Sexual dysfunction and anxiety, depression are in your future. I would rather we slept well than ate well. While I don't think you can out-exercise a bad diet, I can come back and take care of that later. What a poor diet does to the body takes decades. What poor sleep does to a body takes days. It's really important that we sleep well. People that go without sleep have similar issues to those that overconsume alcohol. Their cognitive function declines, their motor skills decline. Their sleep patterns definitely decline. Alcohol and drug abuse are one of the #1 ways to make sure that you don't sleep well. The big, again, vicious cycle here is that those are two things that people turn to when they're stressed about their life, when they're stressed about their finances, when they're stressed about their job. So that's just another thing that makes everything worse. But we do know that a decreased awareness is similar when they get people drunk and they don't let people have sleep for about 18 hours. They find that their motor skills are just about the same. Now, one thing that this ends up being a problem with is how we identify whether or not we're getting a good night's sleep. So I'm going to speed this up really quickly and just say there's a couple of things that we need to pay attention to. Your urge to sleep matters. More importantly, what matters is paying attention to your urge to sleep. Don't stay up past that initial signal that you're tired at 9 o'clock or 10 o'clock at night. If you do, you will get a second wind and it becomes much more difficult to fall asleep or to stay asleep. We need a balance between our relaxation response and our stress response. Managing the stress response or that flight or fight response is one of the more important things that we can do. This is why letting lights be mellow at night is important. That's why not paying attention to your cell phone or your computer or TV is important. It's why we should limit our bedrooms for sex and for sleeping, but TV does not belong there. That's not what that bed is for. When you think about the way people report insomnia, they report it really differently. Some of them will just say, I'm so stressed out, I'm just laying in bed all night, I just can't fall asleep. And then they make themselves anxious not being able to fall asleep. They worry about that sleeplessness, like what am I going to be tomorrow? It makes them very agitated. It makes them turn towards things like stimulants, caffeine, alcohol in many cases, or using something to pump them up, or even worse than that, something to make them go to sleep at night. I'm here to tell you that many of the drugs that are used to help people fall asleep are a problem. They are sedatives. They're not sleep aids. They literally knock you out. And you do not go through the 5 stages of sleep that include lengthy REM cycles. For that reason, it is better for us to think of a first-line therapy being sleep hygiene, turning off lights, keeping our rooms open for sleep, and other activities that do not include stressful activities like the TV. Paying attention to what you're worrying about and how much really you can do about it is what's important. So when we think about quality of sleep, these are your 3 goals. You want to pay attention to sleep duration. You want to pay attention to restorative sleep. That means waking, feeling rested. And you want to pay attention to what's called sleep latency. Understanding or redefining these terms is important because your goal is not to get 8 to 9 hours of sleep. If you can go 6 hours of sleep and wake up feeling like you can take over the world the next day, you slept enough. Restorative sleep. That is what your goal is. The reason why length of sleep is something you don't want to focus on is because as we age, we will sleep less. When we think about different physical factors, we may sleep less, but if you can get good sleep in a short amount of time, that's worthwhile. Dietary and pharmaceutical influences do change the way or how well you sleep, and those are things that can be modified, but they don't get modified just like this. So I don't want people focusing on, I didn't get 8 hours, that means I'm spent or I'm wasted. And then we have to think about where we are in a hormone cycle, a stress cycle, because those will all we all have to pay attention to that. Don't limit yourself by thinking if I can't fall asleep really quickly, then there's something wrong with me. The best thing here from a sleep hygiene standpoint is if you can't fall asleep within 20 minutes, get up. Get up, do something that is restful, that is quieting to you, not the TV, and not really discussions or conversations with people, especially ones that can get heated. You want to make sure that you're paying attention to being restful and spiritual and meditative, whatever, however you define that. If you wait and go, I haven't fallen asleep and it's been 30 minutes, you end up worrying more about the fact that you're not asleep, and that makes things all the more worse. Your sleep goals are to increase your daytime alertness. That means waking up, ready to hit the floor running. You want to make sure that in addition to feeling rested when you wake up, that we pay attention to the habits will help us sleep better. You want to decrease any frustration around sleep. So it's worthwhile to communicate with a partner if they're kicking you in bed, if they're snoring, if there's light pollution in your room. It's worthwhile finding alternatives to make sure that those things, that you can handle those things, that you identify what's modifiable and what's not modifiable. One thing I'm going to say here, just before I finish on the next slide, is this. What is not a solution for long-term success in sleep or marriage is kicking your spouse out of the room. I know it looks like it's a really sexy thing to do right now, to go, I just have to get some sleep. You need to go on the couch. You need to go over there. You'd be surprised at how quickly that becomes a habit, how quickly that becomes the solution. And in the long run, playing the long game, that is no good for your stress, your future, or the well-being of you and your spouse. That itself is not a solution, even if it looks like the one that you want to try right now, just so you can get some sleep. So believe me, you want your spouse next to you and some earplugs in your ear more than you want your spouse not next to you, because touch is a big part of feeling well, that quality of life. This was the last thing I wanted to say. Drugs and alcohol do directly affect our sleep, leading to shallow sleep, broken sleep, or fragmented sleep. Alcohol, just like kicking your spouse out of the bed, is not a solution. Drinking alcohol to fall asleep or to sedate yourself is not a solution. Drugging yourself is not a solution in doing this. in restful sleep. There are ways that you can sleep restfully with things like magnesium. There are ways that you can sleep restfully with things like valerian root. There are ways that you can sleep restfully with meditation. This is just to talk about don't beat yourself up if you can't sleep well. The best thing that you can do is get on a sleep cycle, manage your stress. What it's saying here is deviating from sleep patterns even over a weekend can take days to get back into the swing of things. So if you do not go to sleep at the same time every night and wake up at the same time every morning, even on weekends, you're setting yourself up for failure. The next slide is just the ending slide, and I want to be able to answer your questions. I'm positive I went over because that's what I do. That's what I do. Just a brief summary. Sleep hygiene means paying attention to patterns that can cause concern. It could be stress. It could be heated conversations. It could be the TV on. It could be pharmaceuticals. It could be alcohol use, excessive eating, or large portions too late in the evening. It can even be things that we perceive as helpful, like exercising too late in the evening. Cortisol goes up when you do that. Human growth hormone that is meant to support and repair the body doesn't end up peaking when it should if you exercise at night. There's a lot of triggers for poor sleep, but stress is the #1 trigger for poor sleep. And many of the solutions that we use on a daily basis to manage stress really cause fragmented sleep, not better sleep. While you may be sedated, you're not sleeping. And that's a big problem in the long run. Okay, so I want to be able to answer your questions about sleep, about nutraceuticals, minerals, vitamins, dietary habits that can change your sleep habits. I'm a talker, I know.
What foods do you say that really do inhibit the good sleep hygiene?
Well, the thing that's really interesting about that is many of us were told to drink a cup of warm milk before we went to sleep, and that will help us sleep. That's actually not true. Denatured proteins can be a problem. It takes actually a lot of work to break down a protein. It takes a lot of work to manage proteins. So if you, amino acids are fine because they're already broken down. But things like heated milk is probably more comforting than anything else. If a body drinks a lot of liquid at night, not only will it normally have to get up in the middle of the night to urinate, that sense of fullness can be a problem with sleep. Milk and proteins can be a problem, so eating a big meal can be an issue with sleep hygiene. This idea about 2 hours before you go to sleep is a difficult one because a lot of people do it for weight loss. They don't eat for 2 hours before they go to bed at night. And that's fine, but the bigger issue, because you don't want a big meal and then crawl into bed and fold yourself up into an L and watch TV. But the bigger issue is more about what we ate than how much we ate. So big protein and big fat meals within 2 hours of sleep can be an issue. Maybe a bigger issue is the fact that people don't go to sleep until way, way, way later than they had intended, or than their body thought it was going to go to sleep. Foods that are very good to help you fall asleep are things like some fruits, and avocado. Strawberries, bananas, and avocados. You don't have to mix those all together unless you're a little bit of a weirdo. Those are all serotonin boosting. When we think about things, other things you've probably heard about, L-tryptophan from turkey. That's true, poultry, but turkey being the best has an amino acid called L-tryptophan. L-tryptophan is converted with the help of vitamin C and the help of something called riboflavin, B2, to turn into serotonin, and ultimately serotonin turns into melatonin. So many people will manage sleep headaches with L-tryptophan and magnesium, B2, and vitamin C, because those are all the building blocks for serotonin. A lot of people that have headaches will complain that they don't have sleep, but the reason why they have headaches and don't sleep is because they have very low magnesium, which means they're going to have very, very low serotonin. So things that can build up serotonin, bananas being one of the best, or things that can feed you L-tryptophan, and that's turkey, or taking an L-tryptophan supplement. those are how you get to eat, kind of hit more than, kill more than one bird, or kill, what's the adage there? Kill
two birds with
one stone. Thank you. That's where you kill 2 birds with 1 stone. You use L-tryptophan. It helps manage stress, serotonin, and sleep.
Okay, so you mentioned the L-tryptophan. What about that melatonin over the counter? Is that?
Well, okay, I'm glad that you asked that, because melatonin is good for that, like, short term, I'm not sleeping, I need some support. It is worthwhile to use melatonin if you are a shift worker, so you can't sleep during normal sleep hours, or if you're coming back from an international flight, something like that. Grief is usually something that will keep people up for days. Melatonin is appropriate then as well. One issue, though, with melatonin is that it's not taking care of some of the other issues. Melatonin is the last stop on the train for sleep. Serotonin production is important because stress being one of the bigger reasons why people don't sleep. Melatonin can be back converted into serotonin, which means it won't help you sleep. It will help you make more serotonin, which is good for the stress issue. But what ends up happening is that you don't end up falling asleep, and you think you need more melatonin. Your brain makes melatonin. Your pituitary gland makes melatonin. It won't do it in the presence of your iPhone, though. So that's why getting rid of your iPhone in the bedroom is really important. Your brain makes melatonin in microgram doses, in tiny, tiny doses. Unfortunately, what's available over the counter is in milligram doses. It's more than your brain would ever make during a night, and so it has benefit to knock you out, but it's not a good thing to use on a regular basis. You have to take honeymoons from things that are strong. Melatonin in milligram doses is considered a strong sedative, so you want to make sure that if you are doing it, that you're using it appropriately, because there's grief, there's something really, really stressful going on, shift working, international flights, and no matter what, that you take a honeymoon from it. That means 3 days on, 2 days off, 5 days on, 3 days off, something like that. But you have to honeymoon from melatonin. Yes?
What sleep management tips, just to get like REM cycles and stuff, would you recommend? Like, I've got a new baby at home right now.
Okay.
So that's obviously, she's interrupting like the normal sleep process,
Right.
Not so much for me, but for my wife, she is complaining about like having headaches and stuff again right now, which she had before, and she was able, while she was pregnant, to manage that with chiropractic care, but
Right, there's things that kind of calm and worked with her nervous system to support her. So one of the things, and parenting is one of the obviously more difficult triggers when it comes to sleep, because the baby needs you as frequently as she does. So if you guys are not having the baby in the bed with you, that's one way to manage that. Swaddling the baby is an important thing to do so that the baby feels safe or feels that. But from a sleep hygiene for her, magnesium foods are a worthwhile thing to do, because that's going to manage the headaches.
Right. And
magnesium foods, which are going to be things like beans, dark green leafy vegetables, making sure that even meat, although not big, I'm a big fan of meat, but not big portions of it right before bed. But things that are rich in magnesium are going to help her not just with the headaches, but are going to help her with that sleep cycle.
Right.
If the best you can do to follow going to sleep at the same time every night and waking up at the same time every morning, even if the middle of the night is fragmented, even if she does not want to get out of bed, my recommendation is that she does. Keeping that kind of cycle, just this is when I go to sleep and this is when I wake up, is really, really important.
Okay.
With regards to the TV, like in the bedroom, that you mentioned, and I think you may have hit on it when you were talking about the iPhone being there as well, and the hormone starts with an M that we release naturally. Is that part of the reason why the light of the screen?
It's the light of the screen for sure, but more importantly, it is this very invasive thing that comes into the bedroom that says now this room is for recreation. This room is for TV time. We eat popcorn in this bed. Your bed is quite literally there for 2 things: sleep and sex. Don't watch TV from your bedroom.
How does the lack of sleep affect children?
Here's kind of the funny thing. From an academic performance standpoint, we would think that lack of sleep is a major issue in kids. They end up performing, it depends on how long they've gone without sleep. If they've not slept in 18 hours, their performance will decline, but their sense of alertness, their sense of, I got this, or reaction time is actually quite enhanced. In children, it's just the opposite in adults. Our reaction times slow down, our motor control, we're at a deficit if we go greater than 18 hours. Children don't exactly have different sleep cycles. They have different hormone triggers than we do. We tend to see these two cycles, life cycles, be similar. Those that are above the age of 70 and those that are younger than the age of 7, and some people will say 9, tend to have similar sleep cycles. They wake up very early, they want naps in the middle of the day, and then they can fall asleep like this. And you've seen this, whether it's church, a wedding, whatever. You're like, how in the world is Cosmo sleeping through this? Like, you're just like, I would love to sleep as well as kids sleep. When they sleep very, very well, which ends up meaning they can sleep for 4 hours and be very restored and have all of that energy, even if it is at 5 in the morning. But greater than 18 hours will affect their academic performance, but not their alertness.
But how long can they go sleeping 4 hours a day?
Well, again, kids can do this depending on where, so can you give me an age range? Because
15.
Teenagers end up, okay, so teenagers cannot do it. Someone at the age of 15 cannot do well on 4 or 6 hours of sleep. These are kids through growth phases, the hormone fluctuations through puberty. They end up, this is why we see, we call teenagers lazy, but they're not getting out of bed till 11 in the morning because their body's going through a ton of growth. This is like what their growth spurts look like. In this case, this is a hormonal growth spurt. Probably, I'm going to guess that one of the triggers for a teenager not sleeping well, if they are well, and I mean that they're not, because if you're sick, you don't sleep well. But if they are well, I'm going to guess that it has more to do with the stimulation of a TV, their iPhones, video games, texting friends.
And studying, that's a problem.
And, well, again, that's something that's worth also curbing. A balanced life is a much better led life. Curbing that, not letting them have, I mean, they need to get their work done. You can't like goof off all day and then be like, oh, I've got to be up till 1 in the morning getting my homework done, right, because you didn't do it before. That's important. It's like keeping that in control. These are work hours, just like you and I have work hours.
Dr. D, someone who has problems with sleeping for years, could that be genetic?
It's organic, but it's not genetic. There are polymorphisms in the body, just genetic variations in the body that tend to make some people overeat or be prone to depression or be limited in how they use hormones or how they use neurotransmitters, but not necessarily something that gets passed down or that we think of from being a hereditary standpoint. Moreover, what we see from that familial aspect, or that trend there, is that we see what parents do, they teach their kids to do.